Only 5 to 10% polyps are cancerous. You can be at risk of developing polyps if you are above 40 and if you are already in postmenopausal state. You are experiencing vaginal bleeding, and even if you are not in menopause state, you are experiencing bleeding in between your period, and sometimes heavy bleeding and unpredictable bleeding is also the reason of developing polyps. If you are experiencing constipation and diarrhea for longer period of time, it means a larger polyp is located around your rectum area, and it could be cancerous as well. Rectum cancer or colon polyp is pretty common. If you are diagnosed with larger polyps, if you see blood in your stool, it could be a sign that cluster of cells are covering your large intestine, and it is also affecting your rectum area. So you should contact your health provider as soon as possible. Sometimes you wouldn't be able to see blood in your stool, but you can have chronic bleeding that could make you anemic. You can have abnormal abdominal pain because larger polyps are developing around your rectum area. If you experience those kind of symptoms, there are chances of developing cancerous polyps. Once you are diagnosed with polyps, your health provider will suggest you to start low dosage of aspirin. Researchers have found that low dosage of aspirin really helps to prevent polyps to convert into cancerous polyps. How it is diagnosed? Usually polyps take 10 to 15 years to convert into cancer, but if you have larger polyps and if you go for regular screening test, at that time your healthcare provider inform you and you will be suggested to do biopsy. During the biopsy, your healthcare provider will take the sample of the tissue of the polyps, or he or she will remove the entire polyps. Then it will send to lab for further checking if that polyps are converting into cancerous polyps. Usually cancerous polyps are found around your stomach area, uterus area and your rectum area. If the colon polyps found in early stages, then it can be removed safely. Removal of polyps is the only treatment if you have cancerous polyps. Treatment for the cancerous polyps is really depends upon the location, size and number of polyps you have in your body. After doing biopsy, if you are diagnosed with cancerous polyps, then you will be suggested to do colonoscopy. Colonoscopy is the only test that allows the removal of polyps during the examination. There are specific stool tests are available that checks the amount of blood in your stool. Besides that, polypectomy is the only surgical process through which polyps can be removed completely. During the colonoscopy test, your doctor will examine location and the size of polyps you have, and then they will do surgery or polypectomy at that time, and your polyps can be cut down easily throughout that process. Your health advisor will suggest you to visit hospital more often for colonoscopy so that he or she can check whether you are developing more polyps or not. This is the general information about colon polyp, rectum polyp, or if you are developing polyps in your stomach or uterus area. If you think this information is really helpful for you, then please take a moment to subscribe my channel. I will see you in my next video. Till then, bye bye.